Hi, I'm Dr. John Mendelsohn. I'm here to talk to you about alcohol abuse. I'm a specialist in addiction medicine, and I've conducted many clinical trials of new treatments for addictive disorders. I also treat patients in my practice in San Francisco. If you really want to stop or reduce your drinking, you should enroll in our program. We provide a safe, effective treatment program that is private, done in your own home, and is affordable. Our protocols are evidence-based and supported by clinical research. We do not require a religious commitment or a stay in an expensive rehabilitation facility. We do all our work in your home and almost on your schedule. Our treatment solution combines FDA-approved medications with a personal breathalyzer to monitor your alcohol use and behavioral supports delivered by a care team. Our system is effective in clinical practice and available now. All you really need to bring is a commitment to change. We'll help you with the rest. What can we do and how can we help you? Our system involves using medications that have been proven to decrease heavy drinking in a wide variety of studies and populations. These medications are safe, effective, affordable, and available. These medications have been studied in numerous clinical trials and have been shown to be effective in a wide variety of patients. They can reduce serious heavy drinking, people who are drinking more than 20 drinks a day, and they can also attenuate people with mild heavy drinking who simply want to lose weight or have less mild adverse effects. The medications are good and work. The other things we bring to the table are a system of monitoring your alcohol use using breathalyzers and a care team that keeps you on track and moving forward. When all of these are combined, your alcohol use will fall dramatically, oftentimes to levels of 10 to 20% of what they were previously. Are you still an alcoholic? Are you still dependent? Possibly. But your alcohol use will decline substantially with our treatment program. There are both immediate and long-term benefits of participating in our program. Immediate benefits include less sleep disruption, less irritability, more ability to focus, more concentration, improvements in your relationships with your spouse or significant other, as well as your family, and improved ability to work and maintain your job. And long-term benefits include less alcohol-associated diseases like high blood pressure, diabetes, long-term nerve damage, or even cirrhosis of the liver. One option for a person with a drinking problem is to do nothing. Just keep drinking. Why not? It's been working up till now. Well, there are many reasons why you should not do nothing. You're here because there's a problem. If there wasn't a problem, you or your family members would not suggest that you do something. The consequences of doing nothing are not good. Alcoholism is a progressive disease. People have progressive stepwise consequences and adverse effects from continued drinking. First, people have impairments in their primary relationships, their families, with their spouses, with people who care about them. Second, people often develop work-related impairments. They start missing work on Mondays. Their work performance declines. They end up with some form of corrective action plan from their employer. Third, they have consequences in societal functioning. These include public intoxication, driving under the influence, even brawling and fighting related to alcohol misuse and use. They also stop doing the things they really enjoy. They stop sports or athletics. They stop going to entertainment, and their lives begin to revolve more and more around drinking. They spend more of their time drinking or spending time with people who are drinking than they do in other activities. This is a real constriction of their lives. They can sometimes feel that this is normal, but the amount of people they interact with and the amount of novel things they do decrease remarkably. If you're at this stage, this is the best point to get treatment. This is the point when treatment has the most beneficial outcomes. Later, alcoholism interferes with employment. People who drink heavily miss work on Mondays. They're often not productive at work. They often lose jobs due to their drinking behavior. Later, they develop societal impairments particularly things like driving under the influence, public intoxication, even brawling and assaults. Fourth, they develop medical complications. Medical complications actually occur at the end stage of alcohol abuse. So by the time people are presenting to the hospital with problems with their liver or their heart, they've been drinking heavily for 20 or 30 years. We hope that we can get you before that point happens, before there's irreversible and long-standing organ damage. But what are the consequences of decreasing your drinking? Well, the biggest consequence is an improvement in your life. Those things that you used to enjoy will return. People who've successfully cut down their drinking can engage in all manner of activities that they find to be more beneficial. These are better relationships, better performance at work, better societal functioning, and a lot more enjoyment. For people who drink heavily and have a compulsion to drink, they're really not enjoying life. What our program can do is let you enjoy life again and do the things that you used to enjoy before you became a heavy drinker. It's time to do something about it and to start treatment. Medications and other beneficial effects. Our treatment program consists of more than just medications. We also have behavioral modification systems that are unobtrusive and will move you forward. For example, just the act of breathalyzing twice a day will give you information about your behavior that is otherwise unavailable. You can use this information to see exactly what you're doing and how you're doing it and chart your progress. That really is an essential part of our program. We also provide behavioral feedback from our care team and our counselors. We also provide automated counseling systems that you can use to improve your life. These are evidence-tested systems as well and can really make a difference in your behavioral approach to drinking and other problems. During your first medical visit, the physician will take a comprehensive history that records your alcohol and other drug use, as well as other medical problems. And we will make sure that you understand both the risks and benefits of treatment. We will also make sure there are no medical contraindications to treatment that we want to prescribe, and that you understand what the treatment does and what it does not do. We will also go over your associated medical conditions to make sure that none of them will interfere with treatment or will require additional treatment along the way. The physician will spend a good deal of time with you, maybe about 30 minutes. At the end of this process, you should have a very good idea about what we offer and what we don't. During the interview, we will discuss with you treatment options, which include medications, the use of our breathalyzers, and the behavioral supports we offer. We will also suggest how to best implement those options so that you can get the most benefit out of our treatment program. Patients may elect to reduce drinking to some preset point, or to reduce drinking in general, or they may set a goal of stopping drinking entirely. In all of these cases, the physician will review the treatment options and explain how we're going to get there. Setting a goal is thus a key part of the initial treatment evaluation. People are often concerned about what treatment actually does and how treatment looks and feels. Patients treated with medications to reduce alcohol consumption often show dramatic results. People who are drinking 8 to 10 drinks a day cut down to 2 to 4 drinks per day. Patients who drink only 1 to 2 drinks a day may stop drinking entirely. Why would someone want to stop drinking from only 2 drinks a day? Well, one main reason might be to control their weight or their blood pressure or to have less effects of diabetes. So for many patients, there is a good reason to control or cut down on your drinking, even if you don't have a diagnosis of alcoholism. In my office practice, I have seen dramatic decreases in alcohol consumption in patients motivated to decrease their alcohol use. The medications, generally speaking, produce only minimal side effects and yet reduce alcohol consumption by at least 50%. Many patients have attained sobriety. The risks of the treatment seem minimal and the benefits easily measured. Here is a typical case. A mid-30s professional who is doing well in his life. He has developed over the last 4 years since leaving graduate school a pretty severe drinking problem. He now drinks 10 to 12 drinks per night and often has blackouts. Family members suggest to him that he needs treatment. Initially, he rebuffs them, but later he agrees that he needs to do something. He tries AA, but finds the overtones of giving yourself up to a religious kind of milieu not to his liking. And he considers a residential program, but does not have the funds to pay for it. So we treat him with medications. Drinking within the first 4 weeks drops to 1/2 of what it was previously. He continues treatment and drinking continues to fall. However, there's been too much damage to his relationship and he loses that particular girlfriend. Despite the loss of the girlfriend, he still continues to take medication, and because of the loss of the girlfriend, his drinking actually increases transiently. We intensify treatment, see him more frequently, add a second medication, and provide more behavioral supports. Drinking then falls back down to a manageable level. Is this patient completely cured of his alcohol abuse? No, he's not. He is still drinking, and he still has some adverse outcomes from his drinking behavior. However, he's now much more in control. He's no longer blacking out. He is not drinking to the point where his health is imperiled, and he is able to develop new relationships and move forward in his life. Is he satisfied? Yes, he's a very satisfied customer at this point, but he still has work to do. So what we see with medication management of alcohol is a lot like what we see for medication management of other diseases, like high blood pressure or diabetes. These diseases are controlled and improved with medications, but not completely eliminated. They allow people to live a more healthy, longer, more normal life and not suffer the consequences of behaviors that they find hard to control. Hence, medications are useful and we recommend them. When people drink alcohol, they are drinking because they want to achieve some effect, some pleasurable effect, where jokes seem funnier, where people seem nicer, where you actually seem more attractive than you might be. You don't drink because you want to get more healthy. You drink because you want to have a pleasurable effect. This intoxicating effect is pretty similar in all of us. We like to be happier. We like to tell more jokes. We like to have more, fun with our friends and family. After we have a drink, our blood alcohol levels rise in a fairly predictable manner. And it turns out that that's dependent mainly on your weight. So if you weigh more or a larger person, you will have a smaller increase in blood alcohol levels for every drink. If you're a smaller person or women, and women get unfortunately stuck with this because they don't have as much water in their bodies as men. That's the only reason. If you're smaller or female, one drink will raise your blood alcohol level more than if you're larger or male. So there's a difference in if men and women are drinking together, women will end up with higher blood alcohol concentrations than men for exactly the same amount of alcohol consumed. And again, smaller people will have a much higher blood alcohol concentration than larger people. But what's interesting about alcohol consumption is not why we drink, but it's why we stop drinking. And it turns out that all of us have a different stopping point when we drink. So again, we're at a party, we're having dinner with our friends or family, we're enjoying ourselves, and we all have a glass of wine or a beer or some other form of alcohol. Our blood alcohol level then begins to rise. So after you drink alcohol, it goes to your stomach. In your stomach, it sits around for a while. If there's some food there, it stays a little longer than if there's no food. But at some point, it reaches the small intestine, where it's absorbed into the bloodstream, then passes through the liver. Part of it is taken away, metabolized by the liver, and then enters the bloodstream in your general body, and eventually gets to the brain. That's where the pleasurable effects of alcohol occur, because alcohol affects the way your nerves work in your brain. So at some point in time after you've consumed alcohol, you end up with a higher blood alcohol level and a higher brain alcohol level. And that level determines how much intoxication you're experiencing. But as I said, the most interesting part about drinking is not the fact that you get intoxicated. It's the fact that you stop drinking. Every person has a different level at which they start to feel the adverse effects of alcohol. And that level determines the point at which they stop drinking. This phenomena, known as low sensitivity to the adverse effects of alcohol, is actually well studied and characterized in the biomedical literature. So for all of us, we go out for our friends and family, we drink, and we enjoy ourselves, and we stop drinking. How we know to stop drinking is because we're beginning to develop adverse effects. People become dizzy, they become tired, they may find their speech is not as fluent as it used to be. They become worried about their ability to stand or walk properly, and they remember what it's going to be like the next morning after they've had a particular amount of alcohol. So if you actually measure the stopping point in different people by measuring their blood alcohol concentrations, and remember we said that the blood alcohol concentration is directly related to the amount of ingested alcohol, and that blood alcohol concentration is directly related to the intoxicating effects in the brain, and is also directly related to the adverse effects that make you want to stop drinking. Some people have a much higher tolerance for blood alcohol concentrations that others find unpleasant. This phenomena, known as low sensitivity to adverse effects, is why people continue to drink in the face of adverse effects, and why some people drink a lot more than other people at the same drinking occasion. It's a very important phenomena, and for most people who develop alcohol use disorder, they have a low sensitivity to the adverse effects of alcohol. So let's review that again. When people drink alcohol, we do so because we want to attain a certain level of intoxication, which is fun. That's why we drink. I enjoy a good glass of wine, and I enjoy a good joke, and I enjoy the two together even more. However, many people find that they really can't stop drinking once they start, and that's because they have a low sensitivity to the adverse effects of alcohol. Why you stop drinking is different than why you drink in the first place. You stop drinking because the drinking becomes unpleasant. And it turns out all of us have a biologically set point at which we stop drinking. So some people stop drinking when their blood alcohol concentration is 0.04, others at 0.06, others at 0.08, and 0.08 is the legal limit of intoxication, and still others at much higher levels, 0.1, 0.12, even higher. If you're a person with a low sensitivity to the adverse effects of alcohol, and you drink a lot more than others before you realize you should stop, you're at much higher risk of developing alcoholism and alcohol use disorder. Now, our medications that treat alcohol abuse work by lowering the amount of pleasure that people have from alcohol. Therefore, the balance between the unpleasant and the pleasant effects is shifted more in the direction of stopping. And this has been biologically shown, and is how the medications work. They also will reduce your craving for alcohol, but the main function they have is to alter the ratio of pleasure to displeasure that always occurs whenever anyone drinks. What are the costs of alcohol use, and what are the numbers of people who drink and are affected adversely by alcohol? Most Americans drink alcohol. Most adult Americans drink alcohol. About 170 million people drink alcohol on a regular basis. Of those, 66 million are binge drinkers. And that's kind of amazing, that number. Binge drinking is heavy drinking on an episode, and it has consequences. Binge drinkers are more likely to progress to serious complications of alcohol use, both short-term complications such as motor vehicle accidents or injuries of any type, or progress to long-term consequences such as alcoholism or alcohol use disorder. In America today, about 1 in 12 people will eventually attain a diagnosis of alcoholism or alcohol use disorder. Now, when we say a diagnosis, it's a little more important to broaden that out a little bit, because a diagnosis of alcoholism is really a reflection that alcohol is doing something bad to that person's life. So what kind of harms are there? Well, again, we talked about societal harms and we talked about personal harms. So we have about 1 in 12 people meeting a diagnosis at some point in their life of alcohol use disorder. And what that really means is they've established an unhealthy relationship with alcohol. There are about 80,000 deaths a year that are associated directly with alcohol use. But there are lots of other diseases that are made worse by alcohol consumption on a regular basis. And these include alcohol-associated dementias, alcohol-associated heart disease, high blood pressure, and a host of others. The costs of alcohol abuse are not just health-related costs. It turns out that about 1/5 of our budget for the police department is spent on dealing with the consequences of alcohol use and misuse. Every police department around the world spends all of its time on Saturday or Friday night taking care of the effects of inebriates, either making sure they don't hurt themselves or hurt someone else. The CDC estimates that each drink costs about $2.15 for both health and non-health related consequences. Your health plan, your health insurance, is paying about $2,000 a person per year for treating alcohol-related consequences. So this is actually one of the biggest areas of health expenditure that is unaddressed in the United States and indeed in the world. As I mentioned earlier, the societal costs are large too. Police departments spend 1/5 of their budget on alcohol-related policing, and 40% of people in prison or jail committed their crime while intoxicated on alcohol. That's an amazing statistic. We have many more people in jail and in prison due to the consequences of alcohol misuse than we have due to the consequences of policing for marijuana use or the consequences of heroin or amphetamine use. It's really an amazing statistic. Thus, the cost of alcohol use is substantial. And if we were able to decrease alcohol use by even a small amount across the population in general, we would decrease substantially those consequences and costs. Now, the statistics, of course, really don't do justice to just how difficult it is for individuals and families to cope with alcohol-related problems. For those 40% of the prison population who have an alcohol use disorder, that's destroyed their lives and their families' lives, and often it's also destroyed the life of the person that they ended up damaging to merit being put into prison. I don't think there's a family on the planet that does not have someone who is personally affected by alcohol abuse. If you're one of the only ones, if your family has no alcohol abuse at all, I would suggest you probably have a very small family and don't know much about them. Many people don't realize exactly how many health consequences there are of drinking that are minor, not severe. So if you decrease your drinking, you can expect improvements in a number of areas. One area is sleep. Alcohol interferes with sleeping. People often say they drink to get to sleep, but after an hour or so, they often wake up. If you decrease your drinking, you will sleep better and have less sleep interruption. Other benefits of cutting down or stopping drinking include sensations of like heartburn and belching and gastric disturbances. I'm sure that many people take a drug like Prevacid or another proton pump inhibitor simply to take care of the heartburn induced by an episode of drinking. If you cut down your drinking, you'll have more focus. You'll have less fatigue. You'll have more energy. These are all benefits of decreased drinking. And these happen almost immediately. On a longer time course, decreasing your drinking will result in a loss of weight. Every glass of alcohol contains more calories per gram than almost any other food. Only fat has more calories per gram than alcohol. Therefore, decreasing your alcohol will substantially decrease the amount of calories you take every day. Other health benefits of decreasing alcohol are your ability to connect to others better, your ability to work better, your ability to be safer in your environment. We've identified 7 points that are essential to helping people recover. The points are: commit to doing something every day to make yourself better. Be humble about your strength and accept help from others. Develop a personal care plan that you can follow every day. Be honest about your setbacks and admit them to the people who care about you. Accept credit for your progress and thank those who have helped you. Spend a few moments every day reflecting on your goals and the challenges to achieve these goals. If you relapse, pick yourself up and do it again. Eventually, you will get there. If you commit to these points and make an effort every day, as well as pick yourself up after you relapse, you will make progress and you will get better. People do recover from addictive disorders, and they do get better and recover their lives. We hope you will join us in this journey to an improved life. Who is on our care team? The care team consists of a physician who specializes in addiction. All of our physicians are trained in internal medicine or family medicine and have had many years' experience treating alcoholics and drug addicts. They are fantastic physicians, compassionate, well-trained, highly recognized, and leaders in the field. Our care team also includes a counselor and coach who will provide the day-to-day contact that is needed to assure you're moving forward. Our coaches are trained professionals who have extensive experience in treating alcohol and drug abuse problems. This individual will be the one you actually interact with most of the time. If you appear to be straying from the course and relapsing, these are the individuals who will reach out to you first. Other members of our care team will also reach out, including the physicians, if you're having a crisis. So every day you'll do the following. You'll breathalyze twice a day, and you'll take a photograph of your medication at least once a day. If we do not get a photograph or we do not get breathalyzer results, one of our care team members will check in with you to make sure you're doing well. Not in a way to criticize you, but to be supportive and to ask what can be done to further your chances of monitoring your alcohol use and taking your medications. Our care team members will also check in with you about stresses that you're experiencing or other things that may be inhibiting your path to recovery. Have you relapsed? Is there a stress that's preventing this? Do you think you don't need the medication? If you breathalyze 0 twice a day for extended periods of time, we will make sure that you're rewarded for it, because that's exactly where we'd like you to be. The breathalyzers we use employ a fuel cell technology that is the same as is used by police departments and hospitals to assess alcohol levels. This is a very high standard of technology, and the results are accurate. Many breathalyzers are less expensive, but do not provide accurate, reproducible results. Our devices do, and they are included in the cost of your treatment program. Residential care, strengths, weaknesses, and problems. Residential care is also known as rehab, and it's what people really think about when they think about treatment for addiction. The myth is that you always have to go and live in a place for at least a month in order to get better. And this is certainly true for people whose drinking behavior is completely out of control, or who, when they stop drinking, have severe withdrawal symptoms. The benefits of residential care are a safe place to withdraw from alcohol and a complete separation from drinking behavior for a short period of time. The problem with residential care is that it ends very quickly, and after 28 days you go home. Pretty much your life is the same, your home is the same, your friends are the same, your drinking triggers are the same, and the majority of people relapse after leaving a brief period of residential care. These programs are ubiquitous in America and are often thought of as the backbone of addiction treatment. Residential care, though, is not necessary for most patients. These people need a supervised medical site to withdraw from alcohol, and they need an immediate, significant separation from their drinking environment. Residential care can be a real help and a real lifesaver for these individuals. So why not just keep repeating residential care? Well, it's expensive. The most inexpensive programs run about $20,000 for a month of care. The most expensive ones can be up to $70,000 or $80,000 for a month of care. And most of us can't afford to keep going back at $50,000 a month for anything. However, most people are not facing a completely out of control situation when they decide to stop drinking. And residential care, in that case, does not offer very many benefits. Residential care also ends. After your 28-day inpatient stay, you need to go home. And when you go home, life is pretty much the same as it was before you went in. The same people are around, the same drinking triggers, the same problems. You're just now considerably poorer, and you've missed work for a month. Our program is considerably less expensive. We charge about $2,000 for a 6-month treatment episode, and we reward you directly. If you stay sober, we'll extend the treatment for free. We have priced our services to be competitive with any other form of treatment of addiction, and in fact, even to be competitive with doing nothing. The cost of our services include, in the first month, the breathalyzer, which we send you, and 2 physician visits. In subsequent months, the costs include a physician visit and all of the care provided by our care team and all the data analysis and reporting on your behavior improvements. If you don't spend any money on treatment at all, you're going to continue drinking. And studies show that most alcoholics spend between $300 and $600 a month, sometimes much more, on drinking alone. Our costs are considerably less than continued drinking. In addition, if you continue drinking, you're not only spending money on alcohol, but you're not doing anything about your problem. And at some point, you're going to have to address your problem and then spend money on that. So, getting started sooner will save you more money than waiting till a later point. If you drink enough and you end up requiring residential care, again, that cost is astronomical. That's $50,000 a month in that range. Because relapse is common for people who are treated in residential programs, you may need to spend that money over and over again before you actually get better. That's not a good deal. There are other treatments for alcohol abuse in the outpatient setting. One treatment's a medication called Vivitrol, and actually I use Vivitrol quite a bit in my practice. It works quite nicely. The disadvantages of Vivitrol are that you need to be seen every month in the doctor's office and receive an intramuscular injection of the medication. The medication itself is surprisingly expensive. It costs about $1,000 a month for medication plus doctor visits. Even so, Vivitrol does decrease the consequences of alcohol abuse and actually costs less than doing nothing. Insurance companies have studied this, and they've concluded that the cost of Vivitrol is less than just having people drink or even sending them to AA. The cost of our program is substantially less than Vivitrol or residential care, or, as we explained earlier, doing nothing. You will spend more money just by continuing drinking than you'll spend by participating in our program. We do not accept insurance payments at this time, but in the future we may do so. Our services are competitively priced and far less than the co-payments you will pay for many other addiction services. For example, if you have a 10% or a 5% deductible and you go for a $50,000 a month residential program, you're going to pay $5,000 for that. Our total cost of services is less than your deductible. Therefore, we believe we offer a great value even without insurance payments. Why aren't there more doctors treating addiction? And in particular, why aren't more doctors prescribing medications that can reduce drinking? That's a wonderful question, and it gets to a lot of what's going on in our healthcare system today. But there's really no pernicious reason about it. Most of the treatments that we advocate and are working on are relatively new. The neurobiology and the science behind those treatments has only emerged over the last 15 to 20 years, and only a relatively small segment of scientists have been funded to do this kind of research. As these treatments emerge, they will gain more popularity, and we're part of that wave of increasing understanding and use of medical treatments to combat a really serious set of illnesses. Doctors receive most of their training in addictive disorders while they're residents. That means they're working in a hospital, seeing patients arrive in the emergency department, and then treating their problems. These patients, as we've discussed earlier, are really at the end stage of their alcohol use. They've already destroyed their relationships, their jobs, they've already had societal run-ins, been in jail or thrown in, quote, the drunk tank, and when they finally arrive at the door of the hospital. These patients are understandably viewed by physicians as hopeless and at end stage. But again, current research shows that we can actually have a great impact if we start treating people early and we get to them before they've destroyed their lives. I think over time you'll see a great number of physicians embracing this form of treatment and using our kind of systems to treat their patients. There are several advantages of our system over waiting for anyone. Of course, why wait? We're available now. But second, we also do something that's actually I think you're going to see a lot more of in medicine in the next 20 years. And that's we leverage the ability of experts to really supervise the care of many patients and deliver even a higher standard of care than is delivered by individual physicians. This is an exciting development, and we're at the forefront of it. We hope you'll come along with us as we develop this evidence-based care into a system that works for everyone at an affordable price, at a time they can do it, and at a place they can experience it. What medications do we use? What are their side effects, and how do they work? The primary medication we use at this time is naltrexone. Naltrexone is what's called an opiate antagonist. It works by blocking what are called opiate receptors in the brain. Opiates are not alcohol, you're saying? How come opiate receptors are involved in the alcohol response? It turns out when we drink, we actually get a surge of opiates in part of our brain. That small surge contributes to the pleasure of drinking. As we've discussed in other sections, if you decrease the pleasure slightly, you allow the adverse effects to emerge and slow your drinking down and decrease it. So the way naltrexone works is by blocking the pleasurable response of alcohol to a small to modest extent. This is enough to decrease people's drinking. Controlled studies have shown that naltrexone works either when given every day, given as an injection over once a month, or even given intermittently to decrease people's drinking. It's really rather remarkable. Our system makes sure that you'll take the naltrexone and gives you a path to chart the outcomes from the naltrexone. What are the side effects of naltrexone? Nausea, usually during the first 2 to 4 days of therapy, is the most common. This is transient and usually gets better. If not, we do have other medication choices. There are no serious adverse effects of naltrexone. Patients are often concerned that if they have an opiate antagonist on board, if they need a strong opiate or need surgery, will the doctor be able to operate or take care of them? And the answer is yes. The blockade for naltrexone can be overcome, and pain medications can be used in hospital settings. However, if you're taking an opiate every day for pain or for any other reason, naltrexone is not for you. It will block the effect of that opiate, and it may even, if you're opiate dependent, precipitate opiate withdrawal, a most unpleasant situation. Naltrexone has been studied in literally dozens of randomized clinical trials. In all cases, it shows some improvement in decreased days of heavy drinking. Many of these trials are conducted in end-stage alcoholics living on the street. These are the hardest populations to treat, yet naltrexone can show effects in these populations. When studied in populations with less impairment and who are less ill, it works even better. Another reason we've chosen it is because it is specifically approved by the FDA for treatment of alcoholism. And finally, the drug is widely available and reasonably priced. Goal setting. One of the most essential things we're going to do with you as you sign up for our program and work your way through our care plan is to set a goal. The goal could be decreasing your drinking by a fixed amount. It could be attaining sobriety. The reason it's important to set a goal is because we're going to get you there, and we're going to work hard to make sure you get to that point. We will help you set a reasonable goal that you can achieve, and we will work to monitor that goal on a daily basis. That's one of our big advantages of our program, something that other people can't really do. The goal of decreased drinking is controversial to some people, but no matter how you slice it, decreased drinking will improve your health. It will also be the first step for those who want it to sobriety. So many of us believe that you will not get to sobriety until you cut down your drinking and obtain some at least minimal daily control over it. But for many patients, sobriety will be the only goal that's worth attaining, and our medications will help you get there and maintain that state. I look forward to working with you. We know you can build a better life, and we're glad to assist in that process.